Some patients are diagnosed with atrial fibrillation just by their routine physical examination. So they don't have any symptoms and their doctor hears an irregular rhythm, or they have a routine electrocardiogram or EKG and that picks up the heart rhythm abnormality, and then we can address it. So I think that it's important that people know that that's one thing, that a very simple pulse check, you don't even have to listen to the chest, can identify the potential for atrial fibrillation. But most people have some symptoms, and so they might say, I'm having a rapid heartbeat, and so the doctor may choose to then follow that up with an EKG, looking for the heart rhythm. In individuals who have paroxysmal atrial fibrillation, where they have little spells, we'll often use a Holter monitor, and a Holter monitor is just a 24-hour electrocardiographic recording. Just think about wearing an EKG for 24 hours. We pick up every single beat, so if somebody has symptoms or has atrial fibrillation during that time, we'll pick it up. We also use, for those people who don't have daily symptoms, we'll use another EKG recorder called an event recorder, and that's something that patients will wear or carry all the time, and when they have the symptoms, they would then press a button and it would record and store whatever was going on, and then we can do a data dump back to the computer that will tell us what the rhythm was. So once we've diagnosed the atrial fibrillation, we will then need to do some follow-up tests to characterize it. And one test that we would frequently and virtually always do would be an echocardiogram or an ultrasound of the heart. We'd be looking for heart pumping function and any other heart problems that may have caused the atrial fibrillation or that need treatment at the same time. Commonly, we might find a valve problem or something like that that we weren't expecting. Sometimes people with atrial fibrillation have completely normal hearts. The other tests that we might want to do are to look for other potential treatable causes, and thyroid, high thyroid levels would be one of those. So it's a simple blood test, but we would want to make sure that individuals did not have elevated thyroid levels, because that would be one of the simplest ways of treating atrial fibrillation. So we need to catch somebody in the act of having atrial fibrillation, catch it on electrocardiogram, and they do follow-up tests to decide how to best treat.